Good afternoon, friends. Greetings from Mumbai. I am Dr. Ramen Goel. I'm a bariatric surgeon at Vocard Hospital, and I would be taking a presentation today on behalf of our Center for Metabolic Surgery. Permanent weight loss, is it possible? So, first, the thing is that it is not about bariatric surgery that we are going to talk today. I was president of All India Association for Advancing Research in Obesity in 2007 to 2009. And that is when we conducted the 5th Asia Oceania Congress of Obesity in Mumbai. And so this presentation is more related to what all possibilities are there. And before I start my presentation, I would like to say that give my regards to Dr. Vinod Dhurandhar, who started this association and who basically gave me the concept of obesity management. And then Dr. Srihari Dhore Patil, who started bariatric surgery in the country from Pune, who trained us in bariatric surgery. So I think this is important that we always recognize our teachers before we have any presentation. So the points that I'm going to cover in today's topic includes what are the reasons for weight gain, because it's very important to understand why somebody gains weight, because then only we are able to treat the obesity. And what are the usual weight loss outcomes that happen with various measures that we are aware of it. And since there's a lot of skepticism about permanent weight loss, it is arising from the fact that patients come back to a dietitian or to a gym or to a bariatric surgeon that they have put on 5-10 kgs back. So what could be those reasons? But that skepticism should not creep into our minds, because this is a challenge to all those who treat obesity. And we have to rise above this criticism to make sure that our patients lose weight. They lose enough weight and they lose it permanently. So is permanent weight loss possible? And this is what we are going to discuss in next 20 to 30 minutes. Now, why does weight gain happens? As all of you know, that there are genetic reasons, hormonal reasons, metabolic reasons. I mean, people say that because a girl has a PCOS, that's why she's putting on weight. While other groups says that because the girl is overweight, that's why she has a PCOS. Or it could be insulin resistance. Then there are environmental factors, and a host of environmental factors are blamed for weight gain, which includes obviously poor diet, lack of exercise, urbanization, cars, lack of sports, lack of sleep, excessive screen time, mobile and TV, environmental pollution. And I could have done an entire talk only on these factors which can cause weight gain, because each one of them has enough evidence to show how each of these elements affect the obesity in general all over the world. So we move on to each one of them briefly in one slide each. So we know most of the nutritionists and people treating obesity know that most person inherit tendency to gain weight. Almost 60 to 70% of obesity contribution comes from their genes. And now there are more than 50 genes which have been identified, which may contribute. But the real issue is that there is no single gene which is held responsible for obesity. And that is where the problem is, because if there is a single gene which can be identified, then probably genetic manipulation can be done so that the future generation will not have weight. But unfortunately, that's not going to happen. And because of this, we see that there are people who are eating moderate amount of food and they are gaining weight, while there are many who eat double that amount of food, and they are still remaining slim. So this itself shows that food alone is not responsible for weight gain. There are factors beyond that, and that is causing causing weight gain in some person and not in everybody. Now, obviously, we can't, there is no treatment which could change the genetic tendency. And unfortunately, we can't change genes. So we need to accept. And this is one question that many patients ask when they come, that my parents are also obese, I am also obese, my children are also obese. So how will your treatment work, or how will your surgery work, or how will your diet work? So we have to accept this fact and then work on it. So this is the basic premise or basic understanding that must be accepted, and then we take it as a challenge and to make things happen after that. Now, before I go to the more detailed things, let's understand there is a single hunger hormone in body which is secreted from the stomach, and which gets suppressed when we eat. So if a person fasts or doesn't eat for long hours, the ghrelin level increases, making person very hungry. And that is one of the major reasons for failure of many kind of dieting, where it is told that you should eat 1 meal a day, 2 meal a day, or you keep large gaps between the meals. Those diets are doomed to fail, because they are not working with the physiology of the body. Frequent small and healthy meals suppress ghrelin and avoid craving. So I think the key takeaway from this slide is uh, healthy meals. So if you are eating frequently, you must eat a small meal and it should be healthy. Because if you are eating unhealthy meal, then the frequent small meals can become a cause of your weight gain. Now, as far as diet is concerned, so the basic treatment modality of any obesity management remains diet. But diet by public is generally misinterpreted as a 15-day, 3 months, 6 months attempt to eat less, or attempt to eat food which is not pleasant, or to remain hungry. Now, this is grossly wrong, because diet has to be considered as a change in habits for life, eating right, eating healthy for rest of the life. So there can't be a 3 month, 6 month, or a 1 year attempt. It has to be a long term attempt and long term habit, so that the person eats gradually healthier and healthier diet. And there is no end to it, because you need to keep on making research, need to keep on improving. Even after 5 years of starting to eat a healthy diet, you will find some more information coming, and you need to adapt to that, so that your diet becomes more healthy. This way, there is always a possibility of weight loss. Now comes the environment. Now, environment is includes everything. Environment is not the air around us. Environment is our eating habits. If you are born in Punjab, in a Punjabi family, probably you have grown on eating parathas for breakfast. While if you are grown in Maharashtra, you have grown on eating poha for breakfast. So this includes eating habits. This includes cooking methods at home. So families which are using conventionally coconut oil for cooking, their daughters and daughter-in-laws or son-in-laws use coconut oil for cooking, and families which are using ghee at home, their children also starts using ghee at home. So I think environment should be taken in a holistic way. How frequently you eat out, how frequently and how much alcohol you consume each time, and how frequently and how much sweet you eat each time. So there are patients who come to us for bariatric surgery, and they say, I can finish a bar of chocolate and I can't keep away from chocolate. So whether you eat a piece of chocolate or you eat a bar of chocolate, ultimately that determines how the calories that you are going to consume. Environment also determines whether you are exercising, whether you are health conscious. So it's very simple. The days you go to gym or you go for a long walk or a jogging in morning, you are unlikely to eat an unhealthy meal. This is very important because uh, people go into unhealthy regime like near a festival like a Diwali or a Eid as it is today, and you have eaten unhealthy for lunch and you say, oh god, today my diet has gone for a toss, so let me have another unhealthy dinner. Now, I'll start it from tomorrow. That's wrong. So that applies on your exercise also, and that is the environment. And there is enough research to show that those who have friends with unhealthy eating habit, then you are also likely to gain weight. So, friends, we don't only inherit our genes, but we inherit our environment, and we can choose whom we want to be and what kind of environment we want to build around us. So, while making this preparing this presentation, I suddenly realized that this lockdown has provided us a golden opportunity to do a kind of research. Those people who lost weight during lockdown probably have a healthier home environment because they were not eating out, they were not having alcohol, they were not meeting their friends as they used to do. So if you this shows that the food cooked at home or whatever you are cooking for yourself is healthy, while those who have gained weight during this long time lockdown period need to introspect, because now they can't blame the restaurants, the fast food, and the sweets or other things outside. So I think lockdown is like seeing a mirror for people with a obesity tendency. And the advantage of seeing this mirror is when the lockdown opens up and when you are able to go to your office, you can carry this impression in your mind and try to avoid situations which influences which come from outside. So I think, especially for people who have gained weight during this period, it's a call that they must meet their nutritionist, and they must take their family, their maid, or whoever cooks at home, and discuss in detail where things are going wrong, because there is no external environment. There were no home food deliveries in the first month, and it is only what is going wrong at home. Now, as far as exercise is concerned, it is accepted that exercise has limited role in acute weight loss, because if you walk on a treadmill for an average speed of, let's say, 5.5 for 30 minutes, you will probably burn 250 calories. And you need to, and that many calories you can get from one portion of a fried food or a piece of sweet. And you need to burn about 7,000 calories for 1 kg weight loss. But the advantage is that when you are exercising on a regular basis, your metabolism increases. And when your metabolism increases, you burn calories even when you're sleeping. You burn more calories when you're sleeping. So I classically give example of the great boxer Muhammad Ali, who had such a big body, but he had only 12% fat in his body and he had all muscles because he was exercising so regularly. And he would have a breakfast of 24 eggs and he will not put on even 100-gram weight, because the calories will get burnt out from the excessive muscles that he had in his body. So I think exercise plays an extremely important role, and we will discuss it in detail later. So just like dieting for 2 to 3 months, short-term exercises, joining a gym for 1 month, 3 months, 6 months, or 1 year, that doesn't help in your long-term weight loss goal. So what are the usual weight loss outcomes? Now, this is science talking to you, that after lifestyle interventions, more than 90% patients regain weight within 3 years. So when I was talking to another friend of mine, he said permanent weight loss is not possible, and I can tell you, I also know that. But I also know so many people who have gone on a diet or who are exercising regularly and have maintained weight even 20 years later. So if 5 to 8% persons can maintain their weight, why not 20, 30 or 40% patients? So I think it's important to realize that it is possible, and this is what we are going to discuss, how it is possible. Why weight loss, long-term weight loss is a challenge. Basic thing is the primary cause persists, whether it is the genes, whether it's hormonal issues or the environment. So we need to work on those things. And then also there is a set point theory that a person has an average weight. So if you have been 90 kg for last 10 years and you try to lose weight, you have come down to 80 kg, it's quite possible that your body starts working against your dieting and tries to bring you closer to 90 kg. So you need to work against that tendency to bring you back to set point of your body. So these are the challenges which a physician and a nutritionist has to encounter and to educate their patients, so that more and more patients come out of that 90% who regain weight. So we should have more people who lose weight permanently with just lifestyle changes. So coming to the topic of the day, is permanent weight loss a reality and it's not a fantasy of one person who is talking to you? Now let's start about the diet part of it. I'm obviously not a nutritionist, so many of you who are probably listening to this would know better about it. But it is now perceived that we don't really need to count calories. What is more important is the quality of food that person consumes. Obviously, the quantity of food is also equally important. And both of these will only work if there is consistency. And consistency is not a factor of patient's willpower. Please understand, majority of the patients who walk in your clinics or nutrition centers have stopped alcohol consumption 5 years back, have stopped smoking 10 years back. So if somebody can give up those habits 5-10 years back, you cannot say that you are weak in your willpower. But they have to be given the tools which they can use and which they can use to lose weight long term. And these tools are basically knowledge based, which the nutritionists have, with exercise therapists have, with physicians should have, and which bariatric surgery provides. So there are different tools in different specialty, and we'll talk about them gradually. So I think as far as food composition is concerned, it's important that we avoid unhealthy food in our diet. And there is a whole set of things that can be discussed, and then this forum and this particular talk cannot take care of everything that is unhealthy and what is healthy. But what is also important is explaining the necessity of balanced meal. All these fancy diets which keep one kind of food group out are not scientifically right for various reasons, because our body's requirements are like that. To just give you an example, those people who are on vegan diet have a deficiency of particular amino acid, and they are more likely to have viral disease. They are more likely to have herpes. So we don't even realize that such a small thing like avoiding all kind of animal source food, which includes milk, by the way, can itself cause a problem. So I think when we say when we talk of the avoiding carbohydrates completely or proteins or particular, it is even more dangerous for the body. And then healthy cooking practice is a major issue at homes in India. And I think this is something that we must emphasize, because if you ask a family of 4 how much fats they are consuming, they will say 2 liters of oil. And then if you probe, 1 liter of ghee and half a kg of butter every month. And you realize what is happening there. And this doesn't include what fats they are consuming when they are going to eat out. So I think cooking practices needs a dramatic workup in every patient's family, whoever is coming to us for weight loss. And then mindful eating. I think mindful eating is something which is so neglected. We go out to a restaurant or we come home and we are hungry, and whatever is in front of us, we start gorging on it without realizing how unhealthy it can be. So I think it's time that when you go to a wedding to attend and you find some food which has floating oil or cream on it, that we say no or we move on and find something which is healthy and eat it. It's not a question of filling your belly, it's a question of filling your belly with a healthy meal. And that is what is mindful eating. Now, food quality. So now the food quality, the components, I'm not going much into it because it's a very complex subject. But let's start with macronutrients like carbohydrates. India has a tradition of using millets. You in Maharashtra, bajra, jawar is so common. You go to tribal areas, they are so common, and even whole wheat. So, so let's use carbohydrates which are complex, so that they are not absorbed faster, and we are not hungry faster, and we are metabolically better. So I'm today concentrating on weight loss. I'm not talking about metabolism or health of the person, but even for weight loss, a complex carbohydrates gives fullness, and the person is not hungry faster. The same thing applies for fats. So I think there is a lot of discussion on saturated fats and unsaturated fats, PUFAs and MUFAs, and one can discuss that. But a little of saturated fat is good for health, and you need to get it from the healthy sources like seeds and nuts and other healthy sources. And overall quantity of fats have to be reduced. 15-gram fats from direct sources like oil, healthy oil is good enough in a day. Then avoid hidden fats. And this is a major problem in India, because we love to drink milk. Indians love to drink milk. We love to have curd, yogurt, and the hidden fats come through that. So if you love them, I'm not saying milk is a very good source of protein in India, but then have skimmed milk or skimmed curd. Because if you are having full fat curd, you will end up having 3 to 4 times more fat in a day through hidden sources, and then also through meat. So unless it's a lean meat from which the visible fat has been removed, the meat itself is a source of a lot of fat in it. So all kinds of meat, it should be consumed as lean meat. And then proteins. Now the proteins is a matter of substantial discussion in the society. The best source of a complete protein is an animal source. So let's say for vegetarians, milk is a good source because it gives you a complete protein. But if you do not want to drink milk or any animal product, then you can have proteins from different sources and combine them, so it becomes a complete protein. But then all this is required to have a long-term weight loss and weight maintenance, because if you have become unhealthy because you're not eating healthy, you are likely to go out of the nutrition program. Then obviously micronutrients, adequate portion of vegetables and healthy fruits are required, so that you don't become sick. Now, there are various kinds of diets. I'm not going by their names or the popular names, but what I'm going to show you is some evidence. There is a study done in 2017 where they compared low-fat diet with high-fat diet. So low-fat diet, which is normally consumed, let's say 20% fat, to a high-fat diet, which is a 40% fat. Now, what they have found, that better weight loss is always seen in low-fat diet at 6 months. And this is a published data. It's not a question of what I preach or what somebody else is telling you. You can go and look at in this literature on this. But as far as diabetics are concerned, if they are having less carbohydrate, it gives them better health. So for diabetics, a low carbohydrate diet is a better diet because of the obvious reasons. So I think, uh, irrespective of what is being discussed in the society, a low fat diet is, or a balanced diet, as we know that 60% of carbohydrates and proteins and fat, is always giving better weight loss in long run. One thing that I am very obsessed about is portion control eating. Limiting portion willfully is key to long-term weight maintenance. And I will show you one or two examples. We have published, unfortunately, I have not put it here. We have published in Obesity Surgery Journal that portion control eating even after bariatric surgery helps achieve almost 97% weight loss even with a gastric bypass. I'll show you the result. So what is portion control eating? Portion control eating is eating what you should and not what you can. When I am hungry, I can have 4 chapatis, 5 chapatis if I really wish to. But I know that I should not be eating more than 2 chapatis. So I stop at 2 chapatis. This is portion control eating. Let's say Indian thali is a classic example of portion control eating. So when I was a graduate, I was doing my medicine. We used to get a thali in my city for 6 rupees, and which will have 2 chapatis, a vati of rice, a katori of dal, a katori of vegetable, and a katori of curd. And there will be it was not unlimited thali. So this was fixed that you get only 2 chapatis and you have to finish in that only. Now that is a classic example of having a balanced diet. And so we call it a Indian limited thali. But then see, now I'll give you an example. This is Indian limited thali, where let's say there's a idli, salad, beetroot palya, sambar, mixed vegetable, and a portion of rice, or you can change it, replace it with dosa or chapati. But what has happened, how it has becomes polluted, is we have gone to this thali which has 6 types of vegetables, sweets here. There should have been a shrikhand here also, and 2 types of proteins loaded with cream. Look at the cream here, oil floating there, tadka here. So, and these chapatis with butter on it, puris here. Now, all that has made a classically healthy meal into an unhealthy meal. And this is a difference between so this is portion control. Thali is a portion control. Thali is a portion control. But an unlimited thali or a thali with loaded with unhealthy food is not going to help our patient at all. So we need to be very specific when we discuss with the patients. Because just saying that Indian thali is good for you, they will go to a Sasuma's restaurant. I don't want to take the name, in Ahmedabad, and they will eat unhealthy Indian thali and will say that my doctor had told me to have this. Now, the second thing, which is even worse, which is hardly discussed. Most of us know that buffets in a restaurant could be 200 types of items, 500 type of items. So most of us try to keep away from this, though many of our patients love to go there regularly. So we keep away from there. But what we do at home, what is a meal for a dinner at home, at my home or your home, classically a family's home, is this any less than a buffet? When you have portions in a casserole or a dongas sitting in the middle of a table, again oil or ghee floating on top, and you are allowed to have multiple helpings, and somebody lovingly, your daughter-in-law or your son-in-law, now the sons also cook, so the son-in-law bringing chapatis, hot chapatis after chapatis. It is no less than a buffet in a restaurant. So I think we need to talk about these issues with our patients, because even I have seen in doctor's house. I was doing a webinar 2 days back, and one of my colleagues from Gujarat started his meal, and I saw the meal was as lavish as this, and there were some more farsan here sitting here at the dinner time. So I think it's very important that we be careful about this. So how does portion control works? You control portion. The patient or the patient's wife or husband controls portion. They serve you a limited portion, and in turn portion controls you, because you are eating only that much portion. So the amount of calories that are going on in are limited automatically, and that helps in weight loss. So you control portion and portion controls you is my mantra for weight loss, and I'm obsessed about it. Now, as far as now we go on the expenditure side of it, we have talked about the income side of it, about the exercise part of it. Now, as far as calorie expenditure is concerned, we all know this fact that 65 to 70% of the calories are spent just to keep us alive. This is called resting metabolic rate. If we are in a bed 24 hours in a day, we don't even move our finger, these many calories will be spent just to keep our heart pumping and lungs working and everything else working. When we walk, when we exercise, when we go to gym, this will add another 10 to 30% of the calories. And 10% calories are spent on digestion of food, or what is called as thermogenic effect. So what can you change in this? By having frequent low calorie meals, you can probably keep it around 10%, or maybe you can take it 12%, so that more calories are spent on digestion of those items. You can exercise regularly so that gradually you come to 30% bracket. So you spend more calories through this. And if you are exercising regularly, over a period of time, your resting metabolic rate also improves. It increases, as I gave the example of Muhammad Ali. So if your resting metabolic rate improves, your patient's resting metabolic rate, so we can practically change all the three parameters willfully, even though the genes remain the same. So let the genes be there. We can change the person's expenditure side. We have controlled the income side. We can change the expenditure side. Now, what is the role of exercise? Every person, irrespective of weight, even if you are 50 kg, you are underweight, you should exercise. And even you have a 70-year-old, you should exercise. Even if you're 20-year-old, you should exercise. Exercise is important for your heart, lungs, and all muscles. So exercise is probably the most important determinant of weight maintenance. More relevant for weight maintenance than for acute weight loss. So this must settle down, because I have patients, and practically all the patients, not one patient, who says, I've been going to gym, I've been jogging, I've been doing this, and I don't lose weight. No, it is because of a campaign of misinformation. Exercise is very important, but should not be given as a acute weight loss solution. It's a lifelong requirement for everybody, and that will help in maintaining weight when the person is changing diet. Now, as far as medicines for weight loss are concerned, they are practically not there. There are just 2 or 3 medicines which are directly advised for weight loss. Others are off-label use, and I would not even like to talk about them. Most of the medicines cause a weight loss of hardly 5 to 8 kgs, and then weight loss plateaus. Weight loss will not happen unless simultaneously you change the diet and the person starts exercising. So, and these medicines, either you continue long term, but once you discontinue, then that weight, whatever weight the person has lost, 5-7 kgs, is likely to come back. So friends, lifestyle changes, diet and exercise remains mainstay of weight loss. and long-term weight maintenance. There is no taking away this fact from any obesity discussion. Now, as far as my specialty is concerned, bariatric surgery. Bariatric surgery is not for everyone. It is for those selected few who fit into this criteria. They are people whose BMI is more than 27.5 and their diabetes is not controlled. They are basically getting it done for their diabetes control and not for weight loss. Those whose BMI is 32.5 and they have a significant comorbidity. We all know comorbidities, what they are, so actively being discussed nowadays in media. So sleep apnea, hypertension, even if they are not happy with their lifestyle, that is also a comorbidity. And if their BMI is more than 37.5 and they have no comorbidity, all of them can be offered surgery. And why surgery if lifestyle is the mainstay for obesity treatment? It's very simple. I'll show you our own results. We have published 3 years and 5-year follow-up data. At 1 year after surgery, patients had lost 87.6% of their weight, extra weight with just sleeve gastrectomy, and 97% of their extra weight with gastric bypass. This is as good as what is seen with biliopancreatic diversions internationally. And this is not because of that we are doing surgery differently, but this is because the lifestyle intervention that we built in with our patients in terms of portion control eating helps improve at least 15 to 20% extra weight loss than in surgeries where that is not done. And then at 3 years, even after 3 years, patients are with sleeve gastrectomy are still losing about 72% extra weight loss is still lost, and with bypass 86% weight loss. You can always say that see they are still 15% weight gain. That is not the issue. The issue is that these patients are extremely happy about their weight loss. 85% or 97% weight loss is like if somebody has 40 kg extra weight, now the person has lost about 38 kgs out of that and is extremely happy about this. So I think when we are talking of permanent weight loss, it should be used more like a metaphor, because ultimately it's what the patient satisfaction is, and ultimately how it improves their health, and that is what makes it a permanent weight loss. So I think bariatric surgery is an excellent tool for long-term weight loss in selected patients. And the selection criteria I have already shown. Just to show you one patient, this young lady, we operated in 2010, I believe, in Fortis Molund. And this lady has lost about 50 kg weight, and even after 10 years is maintaining it beautifully. And it's not the surgery alone, it's because she accepted what was required as far as diet, what kind of nutrition she should take, and she should exercise regularly, and is classic example of how weight can be maintained, long-term or permanent weight loss can be achieved. Friends, there are learnings from lockdown, and these learnings are because we are sitting in our drawing rooms and not operating in the operation theaters. So we have got time to introspect, to think. Just like how we have learned that 80% of information that we got through WhatsApp during this time was incorrect or unreliable. Everything that looked possible did not happen. Was some expert in some Ayog told us that if there's a lockdown in 2 weeks' time, Corona will disappear from the country. It did not happen. So what is required? Factual knowledge is necessary, because logical thinking is not always scientific. And intention or willpower alone is not sufficient. Application of science is as important. And those scientific tools are with you, friends, with the nutritionists, with family physicians, with physicians and bariatric surgeons. Sorry. Use those tools, provide those tools to your patients, let them use this tool, and then You work with them to make sure that they make sure. So it is like giving in, your information was given that you should use mask, you should maintain social distancing, you should have hand hygiene, and the whole country started doing it. Those who are doing diligently are able to keep themselves safe. Those who are not doing are having infections. So the same thing is with weight loss. So learn from this, because this has given a, this is a great opportunity to do research of this kind, to think that how this knowledge can be used in obesity management as well. So friends, my experience of 20 years in obesity management, we first time I met Dr. Dhore Patil was in 2000, and we did the first surgery. Habits do not change automatically. I mean, there are studies, I have not quoted them here, which shows that after bariatric surgery or after a diet, people start believing that their habits, that they will not have a bar of chocolate anymore, will change. It doesn't change. They have to make effort. They also want to go on a normal diet. When will I eat the normally? No, that normal was not normal. The new normal is the new normal. So this has to be emphasized. So may help them change that. Regular sweet or alcohol or even full fat milk is unhealthy. So stop that. Tell your patients this is not done. This is not required. This is like how it is happening in lockdown, that you can't go to a restaurant to eat. And be aware of hidden fats and mislabeling. And this is where I come, one thing that I had missed out during my presentation: mindful buying. If you bring unhealthy food to your house, you are bound to consume it. When we were traveling, I mean, that was another era, BC, before Corona. When we were traveling, uh, I also used to bring chocolates at one time till I stopped buying them. And then I realized at the duty free shop, the most commonly sold items are alcohol and chocolate. And why does one buy them? And so same thing applies when you go to buy I'm not talking of alcohol and chocolates, I'm talking of now when you go to buy something in a grocery shop. When you're going there and you're buying a loaf of bread, are you looking at the label? Is it really a whole wheat, or is it a white flour mentioned there? When they are writing mixed grain, is the first grain is a white flour? So that applies for everything that you're buying. What is the percentage of fat in it? What is the percentage of protein? What is the percentage of carbohydrate in it? So I think the more time you spend in your grocery store, the less time you will require, or your patients will require, with the nutritionists and with the surgeons. So I think mindful buying and mindful eating is as important a tool for permanent weight loss as is bariatric surgery. So to conclude, friends, permanent weight loss is not a myth or a fantasy, it's a reality. When if 80% of bariatric patients can lose weight permanently, if 8% of lifestyle change patients can lose it, why we can't increase that percentage? There are tools, that's why these people are able to do that. Lifestyle changes are required to maintain weight, but these lifestyle changes, what does it include? So these changes have to be lifetime. So lifetime healthy, mindful, portion control eating with enhanced daily physical activity and exercise. I think this sentence sums it all. And this sentence should be told to a patient, that each word of this can help you maintain weight, and all of them together. You cannot have only one of them and avoid all of them. So if somebody is not able to exercise, just by increasing physical activity, they can improve their weight maintenance. And then obviously, bariatric surgery is my profession. So bariatric surgery, in those where it is indicated, because it is known that in bariatric patients or morbidly obese patients, 98% of them will regain weight within 1 year if they go for lifestyle changes. So preferably don't touch them, send them to a bariatric surgeon. But otherwise, permanent weight loss is definitely possible. And if you wish any more information, I am very easily accessible. I would be happy to answer your questions.